Welcome back, ladies and gentlemen, to Axim Biotech's channel, Innovative Diagnostic Solutions, forefronting this industry in the healthcare space. John, the Chief Executive Officer, thanks for coming today.
Thanks for having me.
Always a pleasure. So when we last spoke, we kind of deep dive down into your history, some of the board members as well. But today I kind of want to more or less focus on the business because, I mean, you have two major facets, whether we're talking COVID testing or eye diagnostics for what I think is a dry eye disease. Do you want to break these two things down and exactly what you guys are doing with these ideas, these products, these kind of, just where are you expanding them into, and just anything you can offer there would be great.
Sure. So, we developed, we're quite certain we were the first guys to develop a rapid diagnostic test for neutralizing antibodies. When COVID hit, we were doing rapid diagnostic tests for cancer, for biomarkers for cancer, for QSOX1 lung. But we decided to switch over to COVID because, there's these things called emergency use authorizations. And if you get your hands on one, then you can start selling product. And rather than waiting for the FDA to clear a 510K, 6 years from now, we could get to market right away and hopefully start generating some revenue. So we came up with the idea of creating a neutralizing antibody test. We didn't want to just make an antigen test, which just tested for antibodies from the virus, but we wanted to actually see whether there was protection. And it came from because a lot of people were giving blood for convalescent plasma, and we noticed that up to a third of them really did not make neutralizing antibodies after they got over COVID. And so we were like, well, people are giving blood and a third of it is worthless. How can we make something to show that this blood is good? And so we came up with a neutralizing antibody concept and test. It's a point of care test designed for a point of care test, or maybe at home use down the road, but it's a finger prick, drop of blood, put it on a lateral flow cassette. 10 minutes later, you can tell whether you have neutralizing antibodies or not, and what your level of protection is. And now this was when we developed it. It was actually before there was even vaccines, and so we knew that vaccines would be coming around, and the whole idea of a vaccine is to create neutralizing antibodies. So we knew that our test would roll into the vaccines, or we thought it would. But we're still dealing with the FDA. At the time, I don't think the FDA, they certainly were not focused on neutralizing antibody tests. They were focused on getting tests to the market to see whether or not to try and stop the spread, and focused on the vaccines. So now I think we're getting some movement. The FDA has changed their templates a couple of times for submitting for an EUA. We've had to redo a bunch of tests, and we're continuing to work with that, and hoping that someday we're going to get an EUA for neutralizing antibody tests. But because of some of the time frames that it took for us to get the FDA's attention and get things through, the opportunity came for us to acquire these two dry eye tests that were sort of mothballed. They were already approved, cleared FDA 510Ks for lactoferrin, which is a biomarker for aqueous deficiency dry eye disease, as well as an IgE, which is for allergies. So if you go to the eye doctor and you got scratchy, itchy eyes, do you have allergies or do you have dry eye disease? So we've got two tests that can determine that. They're approved. We've been, we had to take it out of the mothball state, vet a bunch of readers. These are quantitative tests, so they can actually tell you levels specific and give that doctor, precise information, and so that he can then decide on what the diagnostics is. Or not the diagnostics, but what sort of therapeutics he can give them, and then he can test them again to see whether or not what he's giving them is working. So we think we've got really a great solution for dry eye. We know we've got a great test for COVID, and so we've become a diagnostic little powerhouse, so to speak.
Yeah, that's great to hear. I think for most people, they probably have a good understanding of the COVID side of your business. But when you're talking about the dry eye side of your business, can you just talk a little bit about that market scale? Like, you're trying to get these to the doctors that are doing like eye testing, and just, any insights you can just offer a little bit farther in the market scope of exactly like that disease itself and who it's generally affecting?
Yeah, so I mean, dry eye is a $6 or $8 billion a year business. There's 50 some thousand ophthalmologists out there. There's MDs as well. So there's a huge market for us to be able to get our system in there where these doctors can then, test their 200 patients a month that come in complaining of dry eye. So, and then there's offshore potentials as well, but it's a very large market. And, we have 2 of the only 5 approved tests for dry eye disease that the FDA has ever cleared. And again, ours are quantitative, so they actually measure specific amounts versus the other guys that just yes or no.
That's awesome. Yeah. So expanding a little bit beyond that as well, that was great insight. Thanks for that, by the way. But talking about 2022 here, I mean, there's a lot in the macroeconomic environment that's just burning on the retail investor's mind, whether we're talking hyperinflation, logistics problems, the interest rate hikes, all this stuff in between. Do you want to just offer a little bit of insight? Is any of that affecting your business? How do you kind of see 2022 framing out? Just anything that's kind of forefronted for you guys right now?
It really has not affected us in the COVID space at all because we make all of the reagents and proteins and everything that goes on our strips, we manufacture. So those costs have not been, increased. In fact, we're able to make, an additional line of profit there. I think for the dry eye, it's slowed us down a little bit in trying to launch our product because there's, we're waiting for boxes for marketing materials. We've ordered a bunch of readers that have taken longer to get to us. And so there is a little bit of supply chain issue with the readers, but, and the dry eye, but it's really not anything more than a time delay and it's not, massive timelines. So I think we're good.
Well, that's good to hear. So you're a little bit more cushioned in that kind of healthcare space. And obviously, I feel like what you're working on is probably a lot more prevalent. I feel like healthcare is going to become a limelighted conversation for a while from here on in. But on that note, John, I appreciate these insights today. Thanks so much for coming out.
Thanks for having me.
Always a pleasure. On that note, folks, let us know what you think in that comment section below, and eventually we'll do an investor Q&A here. And also consider subscribing for that news as it comes down the wire. But in light of this, stay cool, stay awesome. And as always, I look forward to catching you in the next one.